Do you struggle with describing skin rashes and lesions? Well, in this video, we are going to explore the various dermatology terms we use when describing these skin conditions. Now, this video is mainly targeted at medical students and healthcare professionals, but really anyone with an interest in dermatology may find this interesting. So let us just jump straight to the first term. Now, a macule is a lesion that is flat and that is small, less than 5 millimeters. A patch is a larger macule, over 5 millimeters. So for example, in a patient with vitiligo, you can call these as patches of vitiligo, where they are flat, depigmented skin. A papule is a palpable or raised spot less than 5 millimeters. And similarly to a patch, a nodule is a larger form of a papule. A plaque is a raised patch over 5 millimeters. And the surface can be smooth, it can be rough or lichenified with accentuated skin markings. So in psoriasis, we call these lesions as plaques of psoriasis because they are raised with a silvery scale on top. A wheal is a dome-shaped elevation of the skin because of swelling in the dermis, which is the deeper layer of the skin. So this is also known as dermal edema. And typically when you say a patient has wheals, it means that they have urticaria, also known as hives. A vesicle is also known as a small blister less than 5 millimeters, and they contain serous fluid, which is a clear or slightly yellow fluid. Example of this are vesicles seen in hand-foot-mouth disease. A pustule, on the other hand, is slightly different from a vesicle in the sense that it contains purulent fluid or pus. So you can get pustules in herpes simplex virus infection. Bulla is a larger form of a vesicle, and it is actually quite common in blistering skin conditions like bullous pemphigoid. Now, what is an erosion? Now, erosion is a partial loss of epidermis, which means superficial loss of the layer of the skin. Now, typically when the skin heals from an erosion, there won't be any scarring found. Now, this is in contrast with an ulcer. So ulcers theoretically mean loss of epidermis and dermis. So it is theoretically deeper than erosion. And when ulcers heal, such as say an infected diabetic foot ulcer, the skin heals with scarring and loss of hair. Scales are white flaking of the superficial horny layer of the skin, also known as the stratum corneum. And when there is scales, it means that there is an epidermal pathology. Crust basically means dried fluid. It can be an exudate, blood, and in layman's term, we call this a scab. Now, cysts are epithelial-lined sacs containing fluid or semi-solid material. An abscess, on the other hand, is a collection of pus or purulent fluid in a cavity. A fissure is an epidermal linear crack that reaches the dermis, typically due to dryness. Excoriation basically means scratch marks, and it is a sign of pruritus. And lastly, lichenification means thickening of the skin with accentuated skin markings like the appearance of a tree bark. And this is due to repeated rubbing as seen in atopic dermatitis. Now there you have it. This is my list of common terms we use in dermatology. If you find this useful and you want me to make another video on common dermatology terms, please drop me a like and a comment down below, and I shall make another video maybe titled part 2. Thank you for watching once again. See you next time. Bye!